Alright, YouTube. I had someone ask me a question about like post-op care. So I decided to make a video. I am exactly 3 weeks post-op today. So this is exactly what I've been doing. The only difference is that this is my chest so far. I had double incision with nipple grafts. Dr. Medalie in Ohio. The Right Surgery Center was my location, and Andrea was my follow-up nurse who took my drains out 5 days later. So my surgery was July 23rd. So today I'm exactly 3 weeks post-op. As you can see, I have a little bit of tape left. That little bit of tape has been hanging on for real, for dear life. I actually just got out the shower and I was like, man, this is gonna come off before I make my video. But it hung on for the video. I wanted to have it on so I could show you basically that this tape would be all along the whole incision on both sides. And you can see like it looks like a purplish, like blue color. And a lot of people thought that that was bruising, but that's actually just the purple marker that they use to draw where your incisions would be. So I wanted to show the difference, and even some of the spots that's just like leftover glue that's underneath the tape that's holding on that color. But as you can see right here, this is the actual color of my incision. The peeling that you see is common, and it is supposed to happen. The nipples will peel, and then the color may or may not come back. The darker the tone you are, usually the harder it is for that pigment to come back. But yeah, so that's my chest. I had a blister right here. It's not a birthmark or anything. It was a blister just from the foam underneath my vest. And actually, here's my vest. I am hitting that 3 week mark, so I actually can be out of it a little bit more. It is my choice to stay in it, actually. I think it's a little bit safer with all the activity that I do. Not as far as lifting or anything like that. I still have to wait another 3 weeks before I can even go lifting anything over 15 pounds or even trying to do anything above my head. So I'm just saying, as far as, you know, typing, reaching for a paper, that type of thing. I just do a lot of movement, and the more secure it can be, the better. The compression is used for swelling and stuff, but my swelling is down, as you can see. So, you know, I just, as a safety thing, but I'm definitely not about to sleep in it. So I'm glad to be out of that. But to the actual reason I'm making this video. So how I take care of my incisions now. Once that foam came off, I had to keep my nipples moist. So I had a kit already so that I could travel with it. Sorry for the shakiness in the video. But I had a kit kind of made so that I wouldn't have to carry around a whole bunch of supplies, and if I ever got stuck somewhere, like I wasn't at home or something like that, and I know that it had been that 12-hour mark and I should be changing my gauze out, I had a little bag ready that I could take with me. So I'm going to show you what was inside of my bag. Alright, so this is inside of my bag. This is the cream that is put on the nipple. And then I have Neosporin, of course, to go along the incision. I have regular gauze, non-stick gauze. I have gloves just in case I was in an area to maybe wash my hands, or I could only use wipes or something. So I also have medical wipes in here. And then I have this is a surgical pad that I'll show you a little bit later. So that's what's in my little kit here. So as far as nipple goes, I would put this cream on. So I'd squirt it on my finger. I rub it on my nipple. And then I would take a non-stick gauze and place it over my nipple. Today, I'm actually not going to do that because once my 3 weeks hit, I was told not to use this anymore because it's in like an antibacterial cream, and Andrea told me that after a while, it can actually have a reverse effect on the body and not actually help healing. She did say Neosporin was fine, but she really emphasized on using Vaseline or some other type of like oil. A lot of people have like organic coconut oil and things like that. There's shea butter, cocoa butter. Everybody has their own thing. I'm not here to tell you what you can and cannot put on your scars. Everyone has different results. But a medical professional did tell me that after a while, you want to kind of cut back on the antibacterial creams. So I'm not going to put that on at the second, just because I'm at that mark that I can't do it anymore. But yeah, and then before like the last week when the tape started coming off, I started putting that along my incision just for that last week. I'd even do it over the tape. So yeah, I just wanted to put that out there. As far as the incision goes, I would alternate between the cream and the Neosporin and the Vaseline. Sometimes I would do the Neosporin and Vaseline together. So it just kind of all depended on how much time I had or what I felt like doing. But twice a day, somehow I had something that was keeping those moist. But today I'm only going to be putting on Vaseline. So I get a nice little chunk there. Put it on nipple. Circular motion. And I come up off the nipple a little bit as well. Just because, you know, that area around it too needs to be moist. Alright, so I've done both nipples. They're kind of a little bit shinier than the other. So here's my non-stick gauze. And sometimes I alternate. I would put it on this way, and then sometimes I'll put it on this way. This morning I had it on this way, so I'm going to alternate it and put it this way. There's no reason for that. I just want to just alternate the pressure that's kind of along my skin. I'm going to do this kind of backwards than what I would do, just to show you guys both sides. But so before I would put the non-stick on, I would then go and massage along my scar. This is gentle, and I'm doing it in a circular motion, as you can see. And I'm applying a little bit of pressure as well. This is a little bit of a fast job because I'm trying to keep the video short. So I'll go back over this later, but I also go a little bit under and a little bit above my scar to massage, because all of this tissue is being messed with. So when you massage, it's not just the scar or the incision, I should say. You want to massage above it, around the nipple. I actually end up doing my whole pec. So this whole square area here, I end up massaging with Vaseline, and then I put this non-stick gauze pad on. So that was just kind of a quick rundown. So like after I would do that, I get the non-stick, I put it on just like I did on this side. And then I would get my black vest and put it on. Tonight I'm just going to wear a t-shirt because like I said, I'm 3 weeks, so I don't have to put on my vest. However, if I be going out somewhere, grocery store, taking a walk, anything, I'm going to throw my vest on, my medical vest on. That's me personally, that's my opinion. I want to stay in it about extra week and a half before I don't use it at all. I might even push that out to my 6-week mark. I don't know, that's up to me. The only other things that I wanted to show you guys in this video real quick is the non-stick pads that I use are by Band-Aid, Johnson & Johnson. Walgreens also sells non-stick pads, so this is it. That's what I use. I also use Dial antibacterial soap. People might be familiar with this. It's what you use a lot of times for like when you get new tattoos, like an antibacterial soap. I use that on my incision at first for the first 3 weeks. Now I switched over to Dove Sensitive Skin. There's no alcohol, no color, there's no fragrance. I'm now using this. I'm going to use this out for about a month, and then I'll switch back to like my regular scented stuff. I have sensitive skin, and I just don't like, even with my tattoos, I don't wash that area with scented stuff. I just don't want any breakouts or anything that could set the incision off at all. So I have that. Another thing is surgical dressings. This is the big box that it comes in from Walgreens. I use those exact kind of that area that the guy has it in right there for when I got my drains out. Sorry. I would put it under here. My drain hole is in here somewhere. But I would put it there to catch any excess blood that might be coming out. That was only for the first few days. I actually barely had any leakage. But after a while, what I started doing when this tape started coming off on one side and not the other side, and it would get all over my vest, and sometimes it would stick and it would pull on the incision. I'm going to open one up here. Hold on. So this is what they look like. The blue side faces away from the incision. I would actually, so let's say this whole side was done. I'd put it on like this. Just to be like an extra pad. These do come in non-stick, so if you feel more comfortable with non-stick being along your incision. I still had a little bit of tape on mine, so that's why I use it. It didn't actually stick at all. It didn't absorb up the cream or anything. It was just an extra padding, like I said, in between. But if not, this was what was used underneath for drainage from the drain once they were out. Dr. Medalie had given me those. He also gave these, which is just a long strip of non-stick that I would cut and then place over my nipple. So there's a lot of options that you have as far as non-stick pads go, but it really is key that you have those non-stick pads, gauze for your nipples. You'll be using that a lot. Lastly, you may have seen this in my video for cleaning. It is a wound wash. This is from CVS. I try to get a whole bunch of different brands just because I know there's a lot of different stores and some people have preferences. So I wanted to show that these things are available in a pharmacy that's near you. So I got a wound wash, as you can see here. And I would use a regular gauze. I'd spray it, and I would clean my chest along my incision, and stuff like that before I would do the massaging and stuff. This might be like if I showered in the morning and I wasn't going to shower at night, or again, if I needed to clean, maybe it was hot and I was just sweating a little bit more, even though I wasn't doing a lot of activity. I just want to keep the area clean, and I wasn't at a available place to take a shower. I would use that wound wash. And I haven't had any problems. I haven't had any breakouts or anything like that. So again, this is my chest with this one non-stick on it. So I hope this video helped. If anyone has any questions, feel free to comment underneath. You can find me on Instagram. You can find me on Facebook, Snapchat, Twitter, anything. You can feel free to find me and ask that question if you need it. I will be posting another video with pros, or do's and don'ts of post-op. That was another question. So have a good night.